A very warm welcome to all of you who have tuned in for the Connected Healthcare Breakout session. My name is Emily and I'll be your host for today. The ongoing pandemic has certainly reshaped our society significantly. Connected health has now risen and become part and parcel of daily lives. From online doctors consultation to connectivity in the cloud and virtual system, it is now essential to discuss and discover where the industry is. Before we kickstart the conversation, allow me to welcome Jim Lim, partner and healthcare sector lead of NCS, who will be moderating the panel today. Together with Jim, we are happy to also introduce Ms. Ariza Noor, Chief Corporate Officer of KPJ Healthcare, Mr. Sim Hon Wai, Co-founder and Chief Operating Officer of MDT Innovations, Ms. Viva Shaikh, Assistant Director of UCRES Berhad, and Dr. Gregorius Bimantoro, Chairman of Health Tech Association Indonesia and founder of ProSehat. I will now pass our time back to the moderator. Jim, over to you, please.
Yeah, thank you, Emily. Yeah, thanks for the great introduction of this session. And thanks for having all my distinguished panelists joining this session. So our roundtable topic is called Connected Healthcare, right? So I'm sure every one of us experienced some form of connected healthcare today, right? Especially with COVID. I think telemedicine has become a very common norm for many of us, right? Especially in big countries such as Indonesia and to some extent Malaysia. So a lot of people use telemedicine. But in today's world, telemedicine, I would say, is to some extent limited to a lot of teleconsultation. We do a video call, video chat with our doctors, and then we probably get medicine delivered to us at the doorstep. But telemedicine actually is larger than teleconsultation, right? I actually worked for Good Doctor Technology. I was the founding CEO 2 years ago, right? There was a joint venture between PM Good Doctor in China and Grab in Southeast Asia, right? So when I saw telemedicine in China, it was actually more than just teleconsult. There is AI technology there to help in AI triaging. There is IoT, which is the key thing that we're talking about today. There's IoT there to help in some form of telediagnostic. So maybe I would like to welcome now our distinguished panelists here to share with us, especially those in Malaysia, what do you think is the future of healthcare in the Malaysia scene that's happening today, let's say? And also, how do you think IoT can play a part? And maybe share with us your company's solutions or offerings that actually offers from a telediagnostic or from how IoT can actually help to embrace the entire healthcare perspective. Maybe we can start with the IoT companies that I know of. Hong Wai, you want to share first?
Hi, good afternoon, everyone. My name is Hon Wai, Sim Hon Wai from MDT Innovations. Glad to be in this discussion. I think what happened now, I see that the healthcare sector is increasingly getting more and more demanding. I think the burden has also increased due to the COVID infection, and a lot of hospitals are overwhelmed. That is where I think for connected healthcare is just probably more than telemedicine. You know, it's not about how accessible doctors are. It's also how well the infrastructure is actually prepared to actually scale to treat number of patients, which could be escalating. You know, not just only COVID patients. They are also probably after effect of COVID infection. There will be probably more and more patients coming in, whether it's outpatient or inpatient. So this is where I think from IoT perspective, to get a hospital or any healthcare providers to be ever ready, IoT plays an important part. For example, as simple as traffic monitoring. You know, what are the patients, number of patients that are coming in, and also the readiness of the infrastructure in terms of the hospital, so-called BAMs and FAMs in the facility, engineering and biomedical engineering assets, you know, whether it's fully traceable or fully measurable in order to probably provide the best services to the patient. So that is where I feel that it's not just consultancy, it's also probably coming from operational perspective. And this is where MDT has actually have a lot of experiences in terms of upgrading hospitals from as simple as linen management. We do a lot of that linen management. We sew fabric-based RFID on the linens, you know, whenever they are sent. for washing, make sure the linens are back in the right quantity. So that is pretty important. And also we get the hospital to be fully prepared on areas whereby as simple as the cleanliness of air quality or general conditions in operating theaters, and also the movement of assets, especially those are pretty much mobile, like as simple as non-BAMS assets like wheelchairs, strip stands, they can be missing due to so-called being misplaced or being stolen. Unfortunately, it happens in some hospitals, especially government. And of course, for BAMS assets like defibrillators and also ultrasound, these machines moves. I think this is where IoT can come in, especially not just for tracking and tracing, but also to make sure the assets are in tip-top condition, because these assets needs to be calibrated to be maintained. So that it does not give false diagnosis, to any patients that are being actually applied on. So I think that is where the angle that I'm coming from. I think the operation aspect, IoT will play a very, very important role in order to make sure the hospital is able to scale to as big as possible in order to cater for more and more incoming patients looking for treatments.
Yeah, thanks, Hong Wai. I'm sure IoT can play a big part beyond just telemedicine. So maybe we can hear from Puan Arisa in Malaysia as well to share with us, what do you think IoT has helped your company, or what offerings your company has from IoT perspective to the healthcare business and healthcare sector?
Okay, thanks, Jim. Thank you to the organizers for having me and having KPJ as part of the panel. Now, I guess I would definitely concur to what Hon Wai has just mentioned. I think of course, the rate of adoption of digital in the healthcare industry is not foreign. I think, we're one of the industries that have actually embraced technology much, much earlier. But of course, the rate of adoption has been accelerated because of the pandemic. Now, for KPJ, you know that we are the largest private hospital network in the country. In Malaysia, we've got over 28 hospitals. Now, obviously, being the largest in Malaysia, clearly digital plays a very, very important role, especially in creating synergies for our business. So for KPJ, just sharing with you the experience of KPJ, I think we were one of the early adopters, especially in Malaysia. We have had our electronic medical record more than 10 years ago. So we've always had that already. So what that does is, of course, with the advent of IoT, like what Hon Wai has said, there's a lot of data in there that we're able to analyze. So these are predictive data that will help us to actually focus more on the patients, as well as again on the optimization of our resources and our assets. So I guess if you look at the healthcare industry in terms of the landscape, how has it been different now? Previously, I think prior the pandemic. So I think we've got the prior pandemic, and then we've got the endemic stage. Now, prior to the pandemic, I think healthcare has always looked at. All of our equipments, our diagnostic equipments, are already at top end, and it all has got the functionality to actually have the ability of machine learning. So basically, it's about having those machinery talk to each other and actually analyzing the data. So that is an area that has always been the wealth of knowledge of the industry. So that's something that the industry has been harnessing. Now, of course, when the pandemic came, then I guess apart from just looking internally at the current hospital operations and seeing what kind of data we can use in terms of focusing on the patient's well-being, as well as optimization of our resources. Of course, the shift has also moved towards telemedicine and teleconsult. So we've seen that the business has been disrupted. In the past, if patients were very comfortable to come in person to the hospital to get their healthcare needs. So you see that during the pandemic, that has definitely changed. So people adapt. So clearly, there is a rise in terms of the rate of adoption of telemedicine and teleconsult, especially in Malaysia. So well, in the past, that has never been a real option that neither the operators nor the consumers were willing to do, because everybody values touch point, especially when you're not well. Yeah, so that has definitely changed the way our business has operated, and I think it has mostly disrupted more towards, I guess, primary care, because we in the past, if you used to just immediately see in Malaysia, generally you go and see a doctor, the general physician, the GPs, when you get sick, at the first point of any form of illness. Now you see that a lot more are more willing to go into a teleconsult platform to get the advisory, and also to use of course the telemedicine that comes together with teleconsult. So we've seen that, and that's a new business model that we see is growing. Now, of course, I guess now when you fast forward that, and now we're already coming to the endemic stage. So where are we from there? So clearly the new business model will not go away. So it's just going to get accelerated. And of course, as Hon Wai has also mentioned, now during the pandemic, suddenly home care became quite popular. People contracted COVID, and they were home quarantining at home. So hospital hours also provided that home nursing care as well. So with the advance of technology and IoT, I think going forward, I think in the future you would see that things like what you wear in terms of your Fitbit, and I think during the pandemic, during self-quarantine, it was encouraged that everyone should have an oximeter at home. So what is the point of that? So that is actually another form of IoT as well. So it's all of the gadgets that will then allow you to also look at how you can look at digital health as a bigger ecosystem, especially when you look at patient care, as a whole continuum. Yeah.
Yeah, thanks, Puan Arisa. Very nice sharing from a healthcare provider's perspective. And we all know that in the entire healthcare ecosystem, it's very important that everyone kind of play a part together, like the payers, the patients, the healthcare providers, even the insurers and others, and of course the solution providers, like Hon Wai's company in the IoT arena, right? So all these things become even more important when we talk about digital health, because you start capturing data exchanges. How do you do it in a secure manner and accurate manner? And how do you, like what you mentioned, everyone has an oximeter, but I believe most of our oximeter at home today is not connected. So it's not in a connected healthcare yet. We measure it, we need to still input it manually somewhere in some apps. It will be good that the oximeter is integrated with some apps, and straight away you go there and it can integrate to the hospital or the ambulance. When someone's oximeter, the SpO2 reading is low, straight away the ambulance come. So that is the real future connected healthcare that we all are looking forward to, right? So Jim, maybe I can, yes. Yeah.
Sorry, I need to interrupt you on that.
No
About the pulse oximeter that you mentioned, I think it's really interesting what we have actually implemented. It's we have a pulse oximeter that is IoT device connected to an app. So that is something that we are very proud of, and this is something that is one of the moving factors during this COVID-19 home recovery program. That our oximeter, like what Puan Noor is saying, is actually a very, very useful tool to know a patient's SpO2. So it's connected to the app, and it's not just about data. Data is so unstructured. So our data is more structured in a way that we must make sure that it's able to analyze and predict. So that is really what I think Puan Noor is trying to say here. Like, if the data is just unstructured, it means nothing to a physician. But when the data is structured and there's a predictive analysis to it, that's where AI comes in. And this will actually help to improve care for the doctors. And I think that it's really something, I believe, what is the main game changer of the landscape of healthcare today, which is we see care being decentralized to patient. The legacy of care, not just patient and a doctor, correct or not? No, it's no longer I have to go to a clinic and see doctor. I will decentralize it and be at home, and I get still accessibility to care. I think that is fantastic. I think is the major game changer through this pandemic.
Yeah, very interesting sharing, Viva. Yeah, actually, I was going to ask you because you mentioned that you have already done that, right?
Yes,
so maybe you can because I understand UCRES is a company that has presence in Singapore and also Malaysia, and you actually work with Ministry of Health in either of this country. So if you can share more with us what UCRES does, and it will be good that we can see how we can replicate it in certain other countries as well. Yeah.
Thanks, Jean. Thanks so much for the introduction. Thanks, everyone, for having me here. It's really a pleasure to meet everybody here today. So, as I was sharing again about, what we are doing right now with the home recovery program here, we are very fortunate and really grateful being appointed by Ministry of Health Singapore to be one of the telemedicine provider for COVID-19 home recovery program. So we are actually very, very humble and proud about it, because our system, which is iMedic, our app, and also our IoT devices is also being used by patients to actually one of the data that we actually collected is actually parameters. So it can be as simple as your vital signs, your blood pressure, but these are very basic home care, your temperature and also your SpO2. But what is really fantastic here is because, again, it's a IoT devices, so it's connected. So in that sense, human error is lesser. You don't have to input it manually. So that's what we want. When you reduce error, you increase, kind of efficiency. So we like that. So that's why we built system. It's not just a IoT devices. You need to have an app to actually talk to each other. And not just that, you should also have something that can predict and analyze for the doctors. So that is something what UCRES capability is. And so we are actually helping patients who are basically on home recovery program here in Singapore. So where they are actually perhaps asymptomatic or symptomatic, but they do not need access to doctors because they are not critically ill. So again, the idea is decentralization. You don't want to put everyone in the hospital. The whole idea about COVID-19 is we should give care, critical care, to those who needs it, right? And those who perhaps do not need it. As the others, we let them recover well at home. So when they recover well at home, we should give them an enabling tools. What are the enabling tools? Telemedicine will be one of them, so they can access to a physician at a demand, and also again enabling them with IoT devices so that we can also make very good judgment and diagnosis through these devices. So those are the things that UCRES are doing. And again, like I said, this MOH COVID-19 recovery program is a very good test bed for us to actually put our product out there and also to help and be one of the team player during this pandemic.
Yeah, thanks, Viva.
You're welcome.
Okay, I think there's some echo. Okay. Yeah, thanks for that. So I think home recovery program is a very good program that people start exposing or being exposed to how a home-based care can really happen. We always talk about in Singapore, right? I'm also very familiar with Singapore healthcare system, is that we talk about step-down care. We move from primary care to community-based care, then to home care, and a lot of all these things. That is because we have aging population in general, not just Singapore. I think most part of the world, especially Southeast Asia, is facing that challenge. Aging population, not enough resources, especially manpower resources, nurses, care professionals. So you need to use technology. And one of the key technology is really using IoT devices for monitoring, for detections, and of course, passing back the data so that someone can act on that. So these are very important, right? And I can see that telemedicine or teleconsult kind of taken up very fast due to COVID. And I'm sure very soon, home-based, not recovery, but home-based care, home-based monitoring will actually become a norm in times to come, right, after COVID. So maybe since we talk about so much about telemedicine, maybe I would like to invite our pioneer in telemedicine in Indonesia, Pro Sehat, Dr. Bimantaro, to share with us, what does Pro Sehat do in telemedicine, and also how do you contribute to the scene in Indonesia, and how do you see, because a lot of people, like I mentioned, think of telemedicine as teleconsult today. So does ProSehat already move beyond teleconsult, and what do you do from a telediagnostic or other perspective that uses IoT?
Yeah, so thank you. Basically, what we have done is we have been selected as one of the 11 telemedicine that is helping this COVID-19 situation, especially in the self-quarantine. I think Indonesia was very high in July this year. And then it was the second year. So the first time it was just like, so it's easier for everyone. Like Indonesia have the hospital without wall concept. So last year when we start the program to help the government with all the free teleconsultation, etc., I think we feel it is very limited to do only the tele consultation, while like FIFA also talked before that we need like oxygen, SpO2. Okay, we need more details about what happens actually with the patient side. So then we try to partners with like startups who is a hardware or IoT developer. They already have wearables. Basically, it's more like a smartwatch with SpO2 with a temperature, body temperature, and then in the application they directly connect with us. It is called Wish for Help, and we work in a few countries in Indonesia, not only in Indonesia, but also in other countries in Southeast Asia, like Thailand, Myanmar, etc. And then, but focusing on Indonesia, we provide the teleconsultations. And then we also improve with previously developed like a kiosk sehat. We actually like integrating a few of already licensed healthcare device, and then connect it to the cloud. And through this one, actually, you can do, the model is very limited actually, but that is good enough when we are doing like for the pre-screening for COVID-19 vaccinations. So like ProSehat is helping like almost I think more than 200,000 residents vaccinations, free vaccination from the government. So I think to cut the time, we also use this kiosk sehat in a few places that we are running the vaccinations. So from this learning, we see that I think the future is a telehealth connected device. So we started working more with approved health medical device like ECG monitor, and I think they already have the OEM version, and then integrated with our developer and an IoT partner, another startup that is working with us. So it is now perhaps it's more like the iMedics solution from the US. I already see the video, and this is very interesting because this is just beginning. I mean, this is just beginning. We can do more and more tests accurately when we already have previous data. And I think the doctors, yeah, we can surpass the anamnesis only parts, right? Only interviewing. It's because it's not working actually as a doctor myself. I don't really like doing the teleconsultation only by chat or just video call. I mean, I need data. We need data, like the doctors.
Yeah, thank you, Doctor. Yep, very nice sharing. So maybe before I ask the next question to the panelists, audience, feel free to ask your questions. I think there is a Q&A button that you can put your questions there, and then when we see your questions, we'll be you can direct to any panelist over here, right? Then we'll be sharing that. So that will be more interactive, right? We are not doing we are doing more than a consult here as well. So you can consult the people here, right? And feel free to ask more questions. Yeah. So thanks for all the sharing. Yeah. Doctor, you want to say something?
I want to add a few things. I think I want to add a few things. So actually in Indonesia, other than us, there's a few companies or startups that is doing also like tele-CTG. They focus on maternal health and doing it in a rural area in Nusa Tenggara. In I think it's very rural area because it is included in the program for the like a left behind border area. I think there is also a few innovations from the university like Bandung Technological Institute, ITB, and from the Surabaya. And then there is so many actually new devices that this is the connected device that perhaps before like respirometry, we have respirometry before, like I mean the spirometry, and then they create a version of the miniaturized and connected version. It's very accurate actually, but this is the leap is not only in the connectivity. I think mostly we are a digital player, but even in the hardware side, like the telecommunications, they miniaturize the version of this. I think quite big device become just a cube, small cube, right? So that is very interesting progress actually in IoT in Indonesia.
Yeah, thank you, Doctor. Nice sharing. So, okay, I think we have a first question from the audience. Let me read it out, and I think the panelists, you can click the Q&A button as well to take a look at the question. It's from Hawa B. The question is, how can we educate patients to empower on taking ownership of their healthcare, especially in our aging population, right? So I guess this is a very good question, and people are worried, right? Especially people who are not tech savvy with elderlies. Today, you ask them to use a smartphone. Some of them are learning still, and you ask them to do a teleconsult. Okay, learning, video chat. You ask them to set up devices that they can manage their blood pressure, vital signs. I think it can be a bit challenging, right? You need a caretaker. So I think it's a very good question. How do we actually promote that? Do we need to have very simple devices that is one touch and go, that kind of thing? Or do we need, but how can it be sophisticated enough, right? If it's such a simple devices, or how do we actually promote them to remove, I would say, remove the fear of them wanting to use it, which actually will help them very much, right? Because you can't always go to the hospital or clinics. So how do we promote that? Any panelists want to share? Yeah.
Okay, so I guess I would share this a little bit. I feel it's a very important question. I think it's a very good question. So one of the things that we thought about this, we know that not everyone can be tech savvy. We know that, and of course that will always be a hurdle. So looking at that, there's a solution to this. One of the solutions that UCREST did is we have a caregiver app. So in this caregiver app, what it does is you give access your healthcare information to perhaps could be your daughter, could be your grandson. So when they are having access to your data, or they have the access to your parameters, intervention can take place. So this is to answer the second part. If a patient is, let's look at the boomers, okay, where they are probably in their 70s right now. So these are perhaps patients with chronic illness, and perhaps, using gadgets and all this technology can be very intimidating for them. So in that sense, what can we do to prevent them? How do we navigate that? So we create a caregiver app, and in this app, what it can actually does is whatever parameters that is being taken via the IoT devices or point of care devices that we have, it will be channeled to the caregiver app. So someone is able to still monitor and see and trend what are the situation, what's wrong with my grandmother today. So those are the things that we are looking at, because we know that it will always be a roadblock in that sense. So to answer the other question, how we can empower patients to be more responsible, I think it's very important when you make patient the control person of their own health data. When you have a report of your high blood pressure every day, if you were to take your high blood pressure every day or even twice a week, you have the record, you have the data, it was suddenly embedded in you. Hey, my blood pressure is going higher. You are much more driven to take more initiative on your healthcare. So I think what is the key factor here, you should enable patient to have access to their own medical report. So this could be in form of an app, or even like what Honway is doing, or even what Dr. Bimo is doing, like patient have an app to actually assess this. So when you have accessibility to your own healthcare data, you will take more control and that will empower you. So when you are more empowered, you are able to take care of yourself better. And I think that's how we should shift healthcare, to make patients the enabler. You should enable patients to have access and control their own healthcare data so that they can take much more responsibility of their own healthcare. So we want healthcare to be shifted towards more on that, rather than just curative, preventive. It should be predictive. So looking at your data and your trends of your high blood pressure, you can even know that, hey, I'm bound to probably get hypertension if I don't take care of myself now. Something like that. Yeah, I hope I've answered the question.
Thanks, Viva. So I think you have pointed out that this caretaker is one of the things that can help the non-tech savvy people to really get access to that, right? So that's one part. Anyone want to share what are other incentive or ways that you can put the hand of the health management to the patient themselves in community or home-based settings?
Okay, so in the experience of a healthcare operator, right? Whenever you talk about taking ownership of your healthcare, I think what's important is you've always got to have that baseline study. So you need to know, you need to know what your condition is, so I guess what's important is, as a healthcare provider, we will always promote screening. Now, obviously, when you have got all of your vitals checked up, you do your regular screening, and then you've got that and in an electronic form. Yeah, in a digital form, stored like what Viva was saying, in an app, for example, then that allows for you to then take ownership afterwards to make sure that you are maintaining this step. But it's always important as we shift towards a society that focuses on well-being. We always take stock on where we are as regularly as possible. Yeah. So again, I think the importance of screening should not be underestimated. Now, coming back to what Viva was saying, that yes, I think people should have ownership and they should have access to their own medical records. I think I definitely concur with Viva's view on that. But having said that, again, we do have aging population, and clearly, some with dependents, then you can allow for a caretaker app. But having said that, for a hospital operator like ourselves, what we try to do to also help the communities, especially that we service, is to be closer to the community in terms of our presence. Now, in the past, as a hospital operator, we've always seen that hospital operators generally have large hospital with more than 100 beds, that's operated and depending on the location and the geographies. Now, what we're actually doing now is the setting up of more ambulatory care centers that's closer and more accessible to the community. So, with the wearables that doctor was saying, with IoT, so the other option is also to have it hooked up to your local ambulatory care center, who can also be equipped with the monitoring device to also alert patients, especially those who need a little bit more help in terms of their IT literateness. So that's something that KPJ is now also embarking on. We've just opened our first ambulatory care center that's in a residential area that provides this service. Yeah.
Thank you, Puan. So being close to the community or having community care together with the healthcare provider is another option for this to happen. Thank you very much. So we have caretaker, we have being close, and having community-based care. Hong Wai and Dr. Bimataro, you want to share your perspective?
Maybe I'll go first. I've taken care elderly patients and also younger patients, but I think to make it short, patients generally do not wish to visit hospital very often. I think the motivation of them, getting involved with technology to do home-based monitoring is actually more compared to asking them to attend to hospital visits or doctor consultation. So I think that is where the adoption of remote monitoring is always a big motivation for these patients. I think, of course, fair enough, we have to make the user experience as simple as possible because we have aging population. Those are in the 80s, 90s who are probably also reluctant to wear something in order to monitor their vital stats. But I think with enough so-called good user experience devices and services out there, I would think the adoption rate by elderly patients will be tremendous, because the fact that generally older people are pretty much refrain from going to hospitals every single now and then. So that is my take. But for younger people, I think that is not really a problem, especially let's say we talk about pregnant ladies, those who are suffering from the gestational diabetes. They need to actually, after every meal, they have to do the blood glucose test. I think with some form of remote monitoring device, non-invasive kind of blood glucose meter, I think that is something that will be very important for their gynaes, to actually monitor how well that their tolerance, to the blood sugar, blood glucose, So I don't see that actually being a problem with younger generations. At least, those the Gen X, those born in the 70s, or even the Gen Y in the 80s, So I think that is not really a problem as long as the user experience is taken care of.
Thanks, Hong Wai. Yeah, user experience is definitely very important, especially in the digital world. So there's so many demands of it, right? And I remember working with an elder care center in Singapore, institution in Singapore. They say that I went into the senior care center, the lift have big buttons.
Yeah.
Right? Press, I said, oh, there's very big buttons of different levels to go to. And the apps that's being designed also have very clean UX, UI, and with very simple function that is like, I press something, it will bring me to where I want. Yeah. So
I think the least intervention from the patient itself, it will be the best. We have experience with elderly care in old folks' home, whereby they wear wearables, but we actually picked up incidences whereby, for example, they don't attend to the meals in the morning. Or probably, we picked up incidences whereby they wake up 5 times in the middle of the night. Something must be wrong. But if you ask them to report that, oh, okay, last night I wake up 5 times a night, maybe do I have some issues? They will not say it, So this kind of very seamless reporting tool will be pretty much acceptable to elderly patients.
Yeah, thanks, Hong Wai. So audience, you are reminded that you can ask questions. Feel free to post your question at the Q&A, right? We'll attend to that. So Dr. Bimataro, you want to share about your perspective? How can we actually promote people who want to take care of their own health management? And how do we actually enable the aging population to be able to use all this new technology? If they're not tech savvy, they may not be young enough to learn some of these things. How do we make the adoption higher and willingness to use it?
I think the customer target is actually more like in a sandwich generation. Like, so like I'm taking care my father and my children, right? So basically, we don't have enough time to to see everyone. Like, so if you're working, you need to see your father, mothers, and then your parents, and then also you need to take care of your children. So I think the way that we are going to do is, if we can put some sensor in one of them, then it's much better for us. Like Hanwei said before, right? Before, I think if they are really the parents or the elderly really care about themselves, perhaps they will always share a lot of things with you, and like asking question like why I'm like this and that. But a lot of times they just feel I'm fine, I'm just fine. This is just a bit sore, and then yeah, everything is okay, but you will find it anyway when you are doing like a medical checkup, you're already pushing them. So the earlier we understand their condition, it's actually better for us, their caregiver. So we should target the caregiver, the family caregiver, I mean, and especially if they are more in the sandwich generation with taking care of parents and children.
Thank you, Doctor. So I agree, and if I can summarize, so caretakers being close to community-based care, making it easy to use from a design user experience perspective. So these are the common thing, right? So maybe I can just very quickly share. So NCS in Singapore, 40 years old company, started from National Computer Board, 30 years into healthcare. So we does most of the Ministry of Health and all the different clusters, hospital systems. So one of the things that we're doing for community-based care, for elder home or even for hospital, is to do fall prevention. So that's linked to IoT as well, right? You have all the devices, you have the video cameras, video analytics, and you have stickman diagram that does a fall prevention. So that's one use of IoT. I myself also sit in the board of 2 health tech companies, one in Singapore, one in China, NovoCare in China, and Space MedTech in Singapore. They are all using IoT devices, right, to try to do the monitoring. The one in China is very interesting. Some of us know the triple rifle t-shirt and pajamas from China, right? So they actually embed like a very thin film that can measure acts like ECG, right? It's a threadless wireless ECG, very thin film on the pajamas, and that helps the elderly to really monitor. So there are many of these innovations coming up that we are seeing outside of Southeast Asia, right? So maybe the last question I'll ask my panelists, because we are about 10 minutes into the end of this seminar or webinar, is that now you have a dream, right? You can dream of anything that you want to do, IoT related, right? You are an evangelist. What do you think the future of healthcare will really look like? And how would IoT add value to that? We have seen people doing like mobile clinic using autonomous vehicle. That's one of the case. Using drone to deliver medicine, right? So these are some of the things that's already happening, but not really there yet using IoT. So how do you think today you can dream of anything? What do you think is the future of healthcare going to look like, and how IoT is going to play a part in this part of the future of healthcare? Any takers want to start?
You can dream whether we have a lot of time for that.
Yeah.
But I think, okay, just to keep it short, definitely the burden for healthcare providers to provide tip-top services is going to be more challenging in the near future. I think there will be a lot of applications and solutions coming from AI perspective, which potentially will probably give more accurate diagnosis. I think that is going to be probably the key focus area for the future, because what happens is we may potentially look into reducing the professional indemnity insurance that have to be borne by healthcare practitioners, and some of these mishaps or probably missing or even inadequacies in services being provided, could have a lot of after effect, in terms of so-called damages, claims, by patients. So I think looking forward, I would feel that not just IoT, I think the AI perspective in terms of diagnosis will come pretty much handy. I think there have been a lot of researchers nowadays to look into imaging, scannings, and also records, to pick up incidences or probably diagnosis that probably the doctors may have missed out due to they are too overwhelmed with a lot of patients. So I think that's my take for the future of healthcare.
Thank you, Hong Wai. So any wrapping up words from other panelists on the future of healthcare?
Yeah, very shortly from me. So I guess if you talk about wish lists, I think, for me, I think it's been great to be able to Hon Wai, to Viva, and also Doctor. I think, what's important is, I think, if we want the rate of adoption to increase, I think, we've got to make sure that, we have an improved access. Enhanced quality, and of course cost containment. So now whenever we try to make it more affordable, it's more transparent. So I think, for sure, this reality of wellness, well-being, home care, taking accountability of health, I think it would become possible. And I think, by just using IoT, I think we can do a lot of wonders. And I think, definitely we are looking at prolonged life for many. So I think it's very important that we look at the access as well as the cost as well. So I guess that it would be our wish list, and of course, having the support as well as the policymakers, having them really come in to really drive this initiative would be a major plus point for all of us. I think, UCRES, you're able to showcase what you've done because of, that support that's been given by the Singapore government. So that's something that's very, very refreshing, and that is needed for us to spur this forward. And of course, I think, I can't stress more than enough, I think education initiatives for clinicians as well as public, I think that's very important. So that would make it a reality. So that would end my wish list for digital healthcare adoption.
I will just finalize and add on to what Puan Noor and Honwei is saying. I think I will end off by saying that we need to create a new digital narratives. What I mean by this is creating new digital narrative means we should not fear technology, we should embrace it, and we should all understand it's an enabler, it's a tool, even for physician and even for patient. So when we are able to understand that, the continuum of care will be fantastic and amazing. So I think the digital narrative of even reskilling clinical care, it all has to play a part, because sometimes even physicians fear technology. This is true. So when we are actually able to, recreate this digital narrative, I think all of us will be able to assess quality care. And the whole idea about being digitalization is actually to cut costs in healthcare. I think that is always the end game that we, even in UCRES, wants to enable and help patients, is to make sure that cost of healthcare reduces. So really, thank you so much. I mean, that's how I will end it, like create a digital narrative to change everyone's mindset and understand that technology is an enabler more than anything else.
Yeah, I think it's more into like also incentivize all the stakeholder related, right? Because I think in the connected health right now we are speaking about the benefit that is actually for the user himself, but also for the clinician, also for the healthcare facilities. But we don't have enough incentives to do this, and I think one of the possible, if you are asking my wish list, is a tokenization. Like, so we can create an ecosystem that really give rewards, right? In either way, either using crypto or whatever. I think through the connected healthcare, we can the big data, the big health data is really come through, and there is an exchange right now. It's so hard if we have the personal health record, then how to put it in the physician hands, right? Okay, teleconsultation from one service, can we exchange to others? So there's actually another discussion level of the health information exchange. But if we have the way to do the incentive for all of this as a connected healthcare, I think that will be much better.
Yeah, thank you, my distinguished panelists. Very, very interesting discussion today. We learned a lot of new things, right? We learned about this word. I think not many people knows that IoT, Internet of Medical Thing, is actually a special term created just for IoT in the healthcare industry, right? Just like right, in IoT, industrial IoT, right? So IoT is the second one that I know of. That's something very interesting, and that shows how IoT has a great impact to the healthcare industry. And like what all of you mentioned, is digital narrative, is enabling technology in an ecosystem. IoT alone is good, but not good enough to really promote the entire connected healthcare. To be connected, you need the data, you need the connectivity, like hopefully in 5G, it will really helps in the connectivity, right? IoT, of course, right, as endpoints, as devices, and blockchain, right, cryptocurrency, where you need to secure the exchange of data. So there's a lot of things that we can do together, and Puan Noor already share with us the requirements. So if there are any startup or any companies here, you have nice solution that can meet her requirements and needs, you know who to look for. Yeah. So thank you again. Thanks very much for this distinguished panelists for all your sharing. I really appreciate that. And I hope the audience enjoy the connected healthcare discussion as well. Thank you very much. And over to you, Emily, as the host.
Thank you so much, Jim, Ariza, Honwai, Dr. Bimo, and Viva for such a wonderful conversation. Before we end the session, we will appreciate your response and feedback on the poll that will be popping out on your screen right now. And if you have any further question that you wanted to ask but couldn't get the chance, you can share with us and we will post it to the respective speakers for their replies. With that, we shall conclude the IoT Asia Malaysia Forum. Join us at IoT Asia main event next March to find out more. So you can also contact us as well if you have a relevant solution to showcase at the event. So thank you and have a great evening ahead.